Mongersen, an oral SMAD7 antisense, oligonucleotide, and Crohn's disease. Crohn's disease is a chronic inflammatory illness that primarily affects the terminal ileum and right colon. Crohn's disease-related inflammation is segmental and transmural, leading to various degrees of tissue damage. The gut inflammation associated with Crohn's disease is characterized by abnormal decrease in the activity of the immunosuppressive cytokine transforming growth factor. This is caused by increased levels of SMAD7. Mongersen is a formulation containing a 21-base single-strand phosphorothioate oligonucleotide that hybridizes to the human SMAD7 messenger RNA and facilitates RNase-H-mediated RNA degradation through a classic antisense mechanism. Applications in medicine. Inhibition of SMAD7 production by Mongersen restored TGF-beta1 signaling, thereby suppressing inflammatory cytokine production. Pros: prevents and alleviates Crohn's disease. Rapid and durable effect. No identified safety issue. Cons: not fully tested. Possible risk of fibrosis. Unknown most beneficial clinical dosage regimen. In Ecuador, Crohn's disease is present in Ecuador. Lack of generics. Antidiarrheal monoclonal antibodies. Conclusion: Crohn's disease patients who receive Mongersen have significantly higher rates of remission and clinical response. Some videos. What is Crohn's disease?
Crohn's disease is one of two major types of inflammatory bowel disease. It was named after some really smart guy who lived a long time ago, but I can't remember his name. Any person at any age can develop Crohn's disease, but it is rare in young children. Nobody knows what causes Crohn's disease, but it seems to be an overreaction of the immune system in response to some environmental trigger, perhaps some sort of bacteria or virus. There are genes associated with an increased risk of developing Crohn's disease, but no one gene causes the disease. So what are the symptoms of Crohn's disease? Let's give Michael here the disease and find out. So, Michael, how are you feeling? Not so good? Let's see. You seem to have weight loss, diarrhea with blood, crampy abdominal pain, fever, and loss of appetite. Unlike an infection, the symptoms can last for several months or longer. You better see a doctor. Crohn's disease can cause inflammation and ulcers anywhere in the gastrointestinal tract, from the mouth to the anus. It sounds like it's time for Michael to have a colonoscopy. Yep, just as I suspected. Ulcers in the colon. Crohn's disease can sometimes cause inflammation or an infection that spreads outside of the intestines, called an abscess. We better do a CT scan on Michael to find out. In severe cases, poop can actually leak to the surface of the skin, and that's pretty gross. There is no one good blood test for Crohn's disease, but we better take a small blood sample from Michael here to check. A high white blood cell count or a low red blood cell count are common. Okay, it is time to give Michael here a break. There is no known cure for Crohn's disease, but treatment is pretty good. Antibiotics and anti-inflammatory medications can control most of the symptoms.
Crohn's disease. Symptoms, diagnosis, treatment, getaway gastroenterology.
Crohn's disease is an inflammatory condition that can affect anywhere from the mouth to the anus. And also there's a number of what we call extraintestinal manifestations. It can actually have other effects that affect other, just about any other organ in the body. But the most important thing is that people develop inflammation that typically involves either their small intestine or their colon, and what that often leads to is some combination of diarrhea, rectal bleeding, abdominal pain, unexplained weight loss, and just kind of general fatigue. Those
Living in Crohn's disease, BBC News.
Well, with me now is Bryony Hopkins, who was herself diagnosed with Crohn's disease at the age of 4. Thank you very much for joining us.
Thank you.
So you obviously don't remember what it was like then.
Not much, no.
What was it, though, that led to your parents? You must know that, I guess. What led to them getting you tested? What was going on?
Well, I lost a lot of weight in quite a vast amount of time. I remember I was on holiday in Wales with my family. I was losing a lot of blood out of my back passage, which obviously is not ideal. I wasn't eating. I was very, very sick, and I think it was mostly the blood that my parents were like, I think we need to sort of go and see someone about this. And I went to the hospital. For about a year, they thought it was IBD, and then when I was about 5 years old, they said, no, we think this is Crohn's disease. And then from then on, throughout my whole childhood, it's been sort of plagued by the illness.
And tell us more then about the impact on your childhood.
Most of my childhood, I was in and out of hospital on numerous medical treatments, sort of going from steroids that would sort of make me blow out to the size of a hippo and would sort of make me quite depressed and really bad mood swings, to elemental diet, which is a liquid diet. So for 8 weeks, I didn't have anything, I didn't eat anything, and I was fed through a nasogastric tube that went up my nose and into my stomach. And when it got really bad, because it was my large intestine that was the worst part that was affected, they decided to remove that when I was 13. So from the ages of 13 to 16, I had an ileostomy bag, which is when they sort of bring out your intestine to your stomach. And then I was lucky enough that sort of put me into remission, and once my large intestine was gone, that was kind of the main part of my disease that they'd got rid of, so they could rejoin it now. And I don't have a bag anymore. But sort of my whole childhood was Crohn's.
But it's now under control for you.
Yeah, well, I mean, I am in remission, but I mean, remission is, a tenuous word for anyone who suffers with Crohn's. I mean, I still suffer from really bad fatigue. I still get pain every day. But to me, that's normal, and I don't know any different. But
what have you been told about why you were prone to it? Because presumably at the age of 4, that's solely genetic factors. I mean, we're hearing that the numbers are increasing now, and it's dietary related in many cases. But that could.
For me, I think there hasn't been many sort of clear reasons why I particularly got it, but I think it is probably genetic related. As this research is coming out about junk food, I mean, I don't know much about the science, but I can't personally see how that would be related. I mean, I've got a really healthy diet. I had a really healthy diet when I was younger. I mean, my case is very unusual because I was so young. So I don't know, it might be slightly different to, teenagers that are being diagnosed, which seems to be the trend nowadays. But I think also having a low immune system, what they were talking about, antibiotics, even if I get an infection, the doctors are very, very wary about putting me on antibiotics because my immune system is so low. So I think that's quite an interesting insight that's come out of this research.
And by putting out this research, I guess at least it gets people talking about it, so it raises awareness of it.
Yeah, I mean,
when no one knows what's going on with a little one, especially, it must be very worrying.
I think one of the main things with Crohn's and colitis is that it's so embarrassing to talk about. I mean, no one wants to talk about those kind of things plaguing your life. No, people don't talk about that. It's quite a taboo subject. And I think the rise in young people being diagnosed, I think it's important that the awareness is out there. So if there's something wrong, people feel like they're brave enough to say something and get it checked out.
Colonoscopy of Crohn's disease. Minimal invasive surgery for Crohn's disease at Mongersen Hospital.
This is a case of a laparoscopic ileocolic resection for Crohn's disease. The patient is a 21-year-old male with a 1-year history of worsening abdominal pain and obstructive symptoms. He was diagnosed with Crohn's disease after workup revealed a narrowing of his terminal ileum as seen on this MRI. His condition became refractory to medical therapy, and a decision was made in conjunction with his gastroenterologist to pursue surgical treatment. After a midline incision is marked, local anesthetic is administered, and a Varus needle is used